Hi there, my name is Emily. I'm a third-year medical student studying in Philadelphia, and today I'm going to go over the basics of major depressive disorder. In this talk, I will be discussing the symptoms of MDD, how it is diagnosed, the treatment, and resources for finding additional information. But first, I wanted to make the disclaimer that this talk is created by medical students solely for the purpose of patient education. It is not to be used as medical advice and does not replace seeing a doctor. But with that being said, let's get into the talk. So what is major depressive disorder? At this time, the precise cause of depression is unknown. However, it is believed that MDD is caused by a combination of genetic, environmental, and stressful or traumatic life events. Depression is common, with approximately 1 in 6 adults feeling depressed during their lifetime. MDD is not simply someone feeling sad or being lazy. Rather, it is a true medical condition thought to be associated with changes in brain chemistry and signaling. It is possible for anyone to become depressed, and it is no fault of the individual suffering from it. Symptoms of MDD include a depressed mood for the majority of the day, an inability to enjoy things that you used to, changes in appetite or sleep, feeling fatigued, difficulty concentrating, feeling worthless or carrying excessive guilt, and/or having thoughts about committing suicide. A diagnosis of MDD requires that an individual experience 5 or more of the mentioned symptoms and that the symptoms alter one's ability to function normally and/or perform daily activities for at least a 2-week period. Of note, symptoms of depression can be caused by other medical conditions, certain medications, or substances such as alcohol, which is why it is important to be evaluated by a health professional to be accurately diagnosed. Thankfully, there are multiple treatments for depression, including antidepressant medications such as SSRIs, therapy or counseling, and electroconvulsive therapy, which is a procedure often reserved for more serious cases of depression that involves a brief medically induced seizure while the patient is under anesthesia. It has been found that a combination of medication and therapy is more effective than receiving only one type of treatment. Of course, it is best to speak with a licensed health professional to develop a treatment plan that is best suited for you. It is also worth mentioning that lifestyle changes such as exercising or attending a support group can also help reduce the symptoms of depression. Finally, here is a list of trusted organizations that provide additional information on a broad spectrum of mental illnesses. I have also included links from these sites to their pages discussing depression. Thank you for taking the time to listen to this talk. Here are my sources and my image credits.